This is an overview of rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory disease characterized by joint swelling, joint tenderness, and destruction of synovial joints, leading to severe disability and premature mortality. Furthermore, rheumatoid arthritis is the most common form of autoimmune arthritis. 1% of the entire U.S. population has rheumatoid arthritis, affecting women 3 times as often as men. It is more commonly diagnosed between the 4th and 6th decades of life. However, the disease process can begin and be diagnosed at any age.
So diagnosing RA has evolved over the years, but the 2010 criteria by the American College of Rheumatology uses joint involvement, blood markers, and duration of symptoms, and gives each of those a score, and a higher score being an RA diagnosis. So specifically a score greater than 6 will be you being diagnosed with RA. So going through each of those, joint involvement is the number and size of joints. And so you can get a score anywhere here from 0 to 5. You get a higher score for having more joints involved and also having smaller joints that are involved, since it tends to affect the smaller joints first. And then for blood tests, if you have high levels of C-reactive protein, erythrocyte sedimentation rate, something called rheumatoid factor in your blood, and then also anti-citrullinated protein antibody, this will give you a higher score, the highest being 5 for that category. And then they also give you a point for having a duration of symptoms greater than 6 weeks.
The objective findings of a patient with rheumatoid arthritis may include tenderness when palpating joints, particularly at the joint lines, as well as decreased range of motion affecting the involved joints greater than other peripheral joints. All peripheral joints can be affected, yet the feet and hands can greatly limit an individual's ability to perform activities of daily living and functional activities. The cervical spine can also be affected and is a potential source of neck pain in patients with rheumatoid arthritis. It is less commonly found in the rest of the spine. The picture on the right depicts the physiological inflammation, thickening of the synovial membrane, and degradation of cartilage that occurs as part of the disease process.
So here are some common signs and symptoms that a patient may come to you with if they have RA. First and foremost is joint pain, and this can also go along with swelling in their joints and heat in their joints, so they may be warmer to the touch than the surrounding areas, and sometimes also redness. And then joint stiffness is also a major problem, which tends to be worse in the morning. And you may also see, or they may tell you, that they have nodules under their skin. And these are rheumatoid nodules, and they're just little bumps of tissue, so they're pretty firm to the touch. Other signs and symptoms are systemic, and you see a lot of this because it has a widespread effect on the body. So some of this can be fever, fatigue, weight loss, anemia, and any sort of chronic pain syndrome. And going along with the widespread effects on the body, RA is associated with a number of comorbidities. So RA does affect the blood vessels and can cause vasculitis and atherosclerosis, and can even progress to congestive heart failure. You can also get rheumatic lung, so it does affect lung tissue as well. Different blood disorders, thalassemia, and then also you have to consider with a patient with RA that if they've been diagnosed for a while and have been treated medically, then they may be on medications that are giving them a lot of systemic side effects as well. So this is a good representation, this picture here, of someone with advanced RA. So looking at the hand, you can see something called ulnar drift, which is the fingers moving towards the pinky side of the hand at the MTP joints. And then looking at the thumb, you can also see something called a boutonniere deformity, which is where the most distal joint in the thumb is extended, and then the joint above that is flexed. And then the opposite of this, you can see in the fingers, and this is a swan neck, where the most distal joints are flexed, and then the PIPs are extended.
All right, so when you treat a patient in the PT clinic, it's really important to know whether or not they're in an acute flare-up, particularly because it could lead to exacerbation of their symptoms. Also, low to moderate aerobic activities are important because, again, high aerobic activity could lead to more exacerbate their symptoms. Goal-oriented exercise is really important, especially with a focus on the personal goals of the patient education on what they're doing and why, how it can help, and even a group environment. These can all lead to help increase quality of life. However, there's not much evidence showing that exercise in these patients can lead to a decreasing associated physical impairments. However, the increase in quality of life is significant. Modalities are more used for symptom management, especially gentle heat and ice and electrical stimulation. Splinting and bracing can also be used, especially to decrease pain during activity, especially in the hands. However, there's really not significant findings showing there's functional significance to these splints and braces pertaining to grip strength or helping with fine motor tasks. Prognosis for these patients is fairly poor due to the chronic nature of this disease, as well as the fact that there's not really any known cure. However, if it manifests at a younger age, that can actually lead to a poorer prognosis for later in life. Also, severe RA is associated with a shortened life expectancy of about 10 to 15 years. Early diagnosis and treatment can lead to better control of these symptoms and flare-ups, which can lead, again, to better quality of life for these patients. After they have been diagnosed, a study showed that about 10 years later, about half of the patients were on disability from work, and 15 years later, 2/3 were having trouble with their activities of daily living. Some outcome measures that you can use with these patients include the TUG, which is mostly used for balance mobility, walking ability, and fall risk. There's also the DAS-28, which is the disease activity score, the RADAI, which is the RA disease activity index, the HAQ, specifically the disability index, which is it's a health activity questionnaire for RA, and it's most commonly used for this population. And finally, there's the RAPID-3, which is the routine assessment of patient index data. There are actually many, many more options you can use in this population, and it's important due to the multifaceted nature of this disease that most of these outcome measures have to do with quality of life and the patient's perceived disability, purely because that increased quality of life for the patient shows huge for them. For listening to our presentation.